You're watching Talking Points, a focus on the political scene in Lubbock and across the South Plains.
And welcome back. Here's a look at some of the political headlines of the past week. Former Shallowater Mayor and Littlefield City Manager Mike Arismendes has a new job. Governor Abbott has appointed him to serve on the Advisory Council on Cultural Affairs. They'll send information to the governor about issues that come up because of changes in the demographics of the state. Arismendes is a tech graduate, also a deputy executive director of the Texas Department of Licensing and Regulation. Larry Doss here is a friend, and this is the coolest story I've got to talk about in a while. He's an attorney, partner with Mullen, Hord & Brown here in Lubbock, and thanks to the governor, he's now a judge with the 7th Court of Appeals in Amarillo. He's always been the smartest guy in every room I've ever seen him in, so he'll do great with all this, I know. And then from the horrible timing department, Lubbock Congressman Jody Arrington was all set to have a fundraising dinner in Dallas at the iconic Campese's restaurant, hosted by owner David Campese and his wife, until David had to go and get himself investigated for illegal sports betting. Campese hasn't been arrested, but it's not a good look, so the event has been postponed. In the last 10 years, more rural hospitals have closed in Texas than in any other state. The Texas Tribune hosted an event at West Texas A&M to talk about that problem, and our Crystal Martinez spoke with local state representative Ken King and others about this.
According to the Texas Organization of Rural and Community Hospitals, since 2010, nearly 26 rural hospitals have closed. Currently, 80 Texas counties have only 5 doctors or less. Panelists of healthcare professionals and a state representative discussed ways to solve this issue.
There's not one simple solution, I don't think, but one that is really inexpensive and could be quick would be allowing nurse practitioners to practice to the full extent of their authority, how they're already trained to do. And that's very simply seen across the U.S. and the other states that do that.
Several states allow nurse practitioners to diagnose and prescribe medications. However, Texas does not allow this without a doctor's supervision.
How they're already trained to do, and that's very simply seen across the U.S. and the other states that do that.
In Texas, there are nearly 1.5 million people living in these rural areas, yet many have to drive to larger cities to get the care they need.
We need to start recruiting our own kids that want to live in these small towns and bring them back here. And if we invest in our people, they'll invest in us.
Something a few clinics and medical students are considering.
I really didn't know a lot of those counties or small towns didn't have any kind of healthcare or a doctor where they can go and see. So when I heard the numbers and the statistics in this panel, really just motivated me and actually wanting to do something about it.
All right, that is Crystal Martinez up in Canyon. Steve Beck is the Chief Administrative Officer of Covenant Health, works in their Crosbyton clinic, does a little bit of everything, including acting as the legislative liaison from time to time. So there's no one that we know of more qualified to talk about these things than you, sir, and it's good to have you with us.
Thank you. Pleasure to be here.
Roughly 24, I guess, Texas rural hospitals have been forced to close in recent years. We've talked about that some here on the show. What is that? Is it a lack of patients? Is it a lack of doctors? Is it outside influences? What's happening here?
You know, there's not one single thing, and you know, it's always important to keep in mind, every rural community is different. You can't compare Scurry County to Crosby County or to Andrews. Each is different. However, there are some common themes, and really you can circle around volume, just simply the number of patients being seen. You can circle around what they get paid in reimbursement. Texas is still the state that's one of the highest uninsured states in the nation, and that's a real battle, and it's a real battle in rural communities. So when you put together low volume and then a low reimbursement, it makes for a real challenge for these rural hospitals to stay open.
Does Covenant provide any incentives for folks to go and work in some of these underserved areas?
You know, Covenant directly, no, but I will tell you, you know, Covenant is working because it's important for Covenant. We need our rural partners to stay open. You know, if you look at Lubbock, you look at the number of beds that we have available, we stay full. Between Covenant, UMC, Hart, all of our facilities, we stay full now year-round. And it's important our rural hospitals stay open the best they can because we don't have the capacity to bring those patients to Lubbock. And then if they do not have care in those communities, they tend to put that care off. They become sicker, and they require a higher level of care in Lubbock, and it puts a real strain on the system. So in that so-called healthcare ecosystem, we need our rural healthcare facilities to stay open. And one thing we're working currently with facilities is what would it take? How can we help you keep more patients in your local community? What resources do you need? Is it staffing? Is it education? Is it backup support? We've been having a series of meetings with area CEOs of rural hospitals, with director of nursing of rural hospitals, to find out how can we help you, because by helping you, you're going to help us. So we're trying to work with these facilities to see what we can do to give them some assistance.
We've heard talk about telehealth programs working in some of these places. Is it really working and doing the job that you would hope it would do?
You know, it is an alternative. There certainly are some advantages to it, but let's just be real honest. Telehealth, telemedicine in a rural community is not going to keep a hospital open. Will it assist in providing some access to a higher level of care? Absolutely. For those that can't travel to a Lubbock for a higher level of care, or for those who can't travel, you know, at all, there is a place for telemedicine, and I think it is one piece of the puzzle that can help. But it alone is not going to really sustain a hospital and keep a hospital open.
We've had a lot of politicians in here over the years talk about rural health care needs and various commitments to the problem. Are there any of those campaign issues that they put out there really paying dividends now for Covenant and for its patients in rural areas, or is it talk? No,
absolutely. I think you can look to Senator Charles Perry. He has been a real champion for rural health care. This last session, he led a major effort to increase funding. You know, one of the big issues is lack of reimbursement, not getting paid. You know, rural facilities have a higher level of Medicare, Medicaid, unfunded patients. And while the state controls Medicaid only and not the other programs, he has led efforts to increase Medicaid funding to rural hospitals. There was an effort to increase funding for those that deliver babies. There are fewer and fewer rural hospitals delivering babies, and that's a real crisis in Texas. And he helped lead an effort to increase funding for those to deliver babies. He led an effort to increase basic Medicaid funding for rural hospitals. He also led an effort to help rural hospitals come together on their insurance contracting. There will be an interim study in the next year to look at rural health care. How can we sustain rural health care? What are the needs? So I do give credit to our local delegation, and Senator Perry has been a statewide leader in trying to address some of the basic needs of rural health care.
You mentioned that interim study going on. If you would have a wish list, you would give Mr. Perry and others now to maybe line up now in the interim study that they can present in the next legislative session, or even in a federal situation as well. What would those things be? Or would it be better in some ways to just have them stay out of some parts of this?
No, we need the support. Yeah. We need both state as much federal, and we're working with Representative Jody Arrington, you know, our U.S. congressional representative. And we need some regulatory changes. You know, we're going to have to redesign how we deliver rural health care, or there will be no rural health care. You know, the rules, the structure, the framework that's in place today needs to be changed. And we need to find more flexibility in allowing different communities kind of come together to find out what works best for a Floydada, what works best in Tulia, what works best in Snyder. And we need to get some flexibility and create new models and to have the reimbursement and the regulatory support to go along with those new models. Because if we don't change how we deliver it and the way we deliver it, we won't be delivering rural health care.
Boy, it's fascinating stuff, and take a lot smarter folks than me. Definitely, we need more Steve Becks out there in the world from Covenant Health. Thank you for all the work you're doing on behalf of so much of our rural friends out there who need the help. We'll talk to you soon.
Thank you.